Cooperative Extension is positioned to have a significant impact on population health and health inequities. The 2020 Extension National Framework for Health places health equity as a central goal for Extension efforts and provides a guide for state Extension services to work towards this goal. In alignment with the framework recommendations, Virginia Cooperative Extension has a health program focus area on the prevention and management of chronic disease. As part of that effort, VCE joined the National Diabetes Prevention Program, or NDPP, in 2017. The NDPP is a CDC-supported partnership of public and private organizations working to prevent or delay type 2 diabetes. VCE, in collaboration with the Virginia Department of Health, is pilot testing integrating community health workers with VCE DPP lifestyle coaches to increase the recruitment and retention of underserved populations to the program and promote health equity. Community health worker interventions have been shown to improve outcomes in chronic conditions. The roles that CHWs play to accomplish this are varied and range from cultural mediation between communities and health services to providing culturally appropriate health education. There are several types of community health worker program models. These models vary based on the services provided, the patients and community members they serve, and the goals of the program. We implemented the CHW Outreach and Enrollment Model. 2 community health workers residing and working in Southside Virginia were hired for the pilot study. Following the Outreach and Enrollment Model, the CHWs are using 3 strategies of community engagement to increase awareness of the VCE DPP and enroll individuals at risk for diabetes into the program. They conduct community outreach events, provide information and referral materials to local family medical practices, and reach out to individuals with Medicaid insurance who are referred directly from the Medicaid insurer. The CHWs follow up with referred and interested individuals, assess eligibility and readiness, collect pertinent information from those interested in enrolling, and provide their information to the VCE DPP lifestyle coach. Once the person is enrolled, the CHW continues to follow them throughout the 22-session program to support them in their lifestyle change goals and address any social determinant of health issues that may be a barrier to their success. Dr. Jackie Green-August and Tammy Oakes are the 2 community health workers working on the project. They are conducting outreach activities primarily in the Piedmont and Crater Health Districts. To date, they have participated in 8 community events, making 60 contacts that included assessments for diabetes risk. Of these, 32 people were found to be at risk for diabetes and eligible for the participation in the VCE DPP program. Of these 32, only 2 have registered into a program to date, although the CHWs continue to follow up with all of those who indicated they are interested in enrolling in a program in the future. There were 12 family practices in the outreach area of the CHWs. Letters of introduction were sent to all 12 offices by the VDH medical liaison prior to the CHWs contacting them to make an appointment to discuss the availability of the VCE DPP program and methods of referral. They had 4 scheduled visits and dropped by the offices of the other 8 family practices to provide rack cards for patient self-referral, as well as fax referral forms for the medical professional to make direct referrals to the program. The VCDPP has received 24 physician referrals to date, 12 of whom have been successfully placed in a VCE DPP program. To date, we've received 149 referrals directly from Medicaid insurers of individuals with pre-diabetes. The CHWs have successfully contacted 113 of these referrals, 22 of whom have registered in a VCE DPP program. They continue to follow these 22 individuals as they go through the program and have made 38 referrals to resources related to social determinant of health needs. The pilot has shown the feasibility to integrate CHWs with the VCE DPP program and the advantage for program reach, participant support, and assistance for the extension agents conducting the program. The responsibilities of the CHW align with those of the VCE agent, as opposed to being duplicative. Some lessons learned from the pilot include that community outreach increases awareness in hard-to-reach populations, and that it's important to build relationships with community organizations early to be part of community-wide health efforts. Most healthcare practices in the local community are unaware of the roles and skills of CHWs. This can result in initial resistance. Working through advocates within the healthcare profession can give entree into local practices and the opportunity to establish trust. Being responsive to referrals and conducting programs that improve patient health outcomes is key to that trust building. Clear recruitment workflows and role definitions for CHWs and VCE agents facilitates a good working relationship. And finally, it's essential to have VCE DPP programs starting at regular intervals and at various times of day to meet the demand.